the risk of perinatal psychiatric incidences are increasing during a time like this, especially when it comes to women with diagnoses like obsessive compulsive disorder. You came out with an advisory for pregnancies during a time like this, and that's also available on our portal. But if you could talk about the what happens at a time like this, what happens when you don't have access to your psychiatrist, or you discover that a pandemic like this is making you more anxious than you were.
Yeah, I think we've sort of been seeing a surge of increase in calls by pregnant women, and this must be true for all the obstetricians as well as the mental health professionals on the panel, that there's been an increase in anxiety and related questions. So I just have a woman right now with me who I'm caring for, who basically feels that she's got the infection and she's going to pass the infection to her baby. And that's because the family she lives in is not very hygienic. So she can't go to her mom's place. She's with her in-laws, and she feels they are not being careful enough. They're not sanitizing enough. They're not, careful enough about hygiene. And so there's constant worry about, will I get the infection? Will I give the baby the infection? And this is in the postpartum period. In the pregnancy, mothers are asking us about, should they go for a scan or not? If you go to a hospital, will you catch the infection? And I'm sure the obstetricians in the panel will answer a little bit about that. The third thing, I think a lot of women are not able to go through the rituals that they are used to. And this is a huge thing for some women and huge thing for some families, where they all get together and have that 7th month or 8th month ritual, or once the baby is born, have a ritual. So I've been trying to tell women to do things which are still celebrating the whole pregnancy, but maybe without the kind of ritual which normally happens. So I think there are these multiple challenges for different reasons, and sometimes they all come together. A lot of it is related also to the use of sanitizers, excess use of sanitizers. Is that going to cause a problem to the baby? So mothers who already are anxious, who have some sort of obsessive compulsive kind of traits, are actually reacting much more.
I'd like to go to Dr. Shaibya with the same question, and also add another question from Mahesh Natarajan, who asks, there are a lot of unplanned pregnancies during a time like this, during the lockdown, and people are struggling. Some want to terminate their pregnancies. Some are worrying about the future of the baby, and there's guilt and anxiety and a whole number of emotions that are coming into a situation like this. So if you could take both of these questions, both to do with existing psychiatric issues and also new anxieties, and what if you haven't planned a pregnancy at a time like this?
So I think about 2 weeks ago, there was a WHO letter which came out that there will be 72 million pregnancies in this COVID time, which probably would have been terminated, which would not have continued. But because of lack of access to contraception or early intervention in terms of MTPs, they have not been able to, and these pregnancies will continue. And you can imagine the strain on a family to manage a baby they were not planning to have, and definitely the mental health issues for the mother. So I think this has been a big issue, and somewhere world over, we're not going to get into this over here, but I think the way the medical management of COVID and of particularly of women, we do know that women and children are the ones who are going to suffer the most whenever there are any disasters, and we would consider this a health disaster. So very much so that I think a lot of my friends or gynecologists have been speaking about the fact unplanned pregnancies, especially in young women who are unmarried, a lot of pregnancies happening, having to take medicines in an unsafe manner because they're not able to access doctors, they're not able to access the proper medication. And this is a huge health issue which is completely hidden because these are girls who are not even talking about it. So unmarried pregnancies, plus of course pregnancies in marriage not wanted, and we will not see the fallout till many months later.